This video is brought to you by the CLL Community Canada Facebook group and produced by InnovaHub.ca.
You know that feeling, right? You've just left a doctor's appointment, you finally get out to your car, and boom, it hits you. You completely forgot to ask that one question that's literally been keeping you up at night. Or, hey, maybe you just felt a bit too rushed to speak up about a new ache or pain. Well, if that sounds familiar, you are definitely not alone. Medical visits can be incredibly overwhelming, and it's so easy to kind of just freeze up in the moment. But today, we're going to completely reframe how you approach these visits and focus entirely on putting the power back in your hands.
Okay, let's dive into this. Welcome to this explainer on empowering your care, communicating with your medical team. Listen, if you're navigating a CLL or SLL diagnosis, that's chronic lymphocytic leukemia or small lymphocytic lymphoma, how you talk with your doctors isn't just some nice-to-have skill, it's absolutely vital. We're talking about you taking control of your health journey, and we're going to look at the very specific, highly actionable ways you can make sure you're getting the absolute best care possible.
Section 1, Your Healthcare Partnership and Two-Way Communication.
Managing a condition like CLL or SLL, it's not a solo endeavor. It is a total team effort. Think of it kind of like a bridge. Your medical team absolutely depends on good, accurate information flowing from you, and in return, you depend on clear, practical guidance flowing back from them. And please hear this, your job is not to diagnose the problem yourself. Actually, scratch that. You don't need to go to medical school overnight. Your job is simply to be an observant reporter. You just need to notice changes in your body and report them clearly. It's their job to take that info, figure out what it means, and give you a plan. Taking the pressure off yourself to have all the answers, that's a real game changer.
But because your job is to be that star reporter, relying on your memory alone, yeah, that just won't cut it. Taking notes is absolutely essential. It's a highly effective way to ensure those crucial details aren't forgotten the second you step into the exam room. When you track your symptoms and actually speak up when something feels off, you're handing your doctors the exact data they need. It makes spotting issues early a breeze, and honestly, it saves you from spiraling into a whole bunch of unnecessary worry.
Section 2, Spotting the B symptoms and knowing what to look for.
So, what exactly should you be taking notes on? Well, you might hear your doctor throw around the term B symptoms. Now, what's really interesting about this is that these aren't your everyday aches and pains. We're talking about specific physical signs, namely fever, sweats, weight loss, or fatigue that suggest the CLL or SLL might be getting more active. These are serious signals. So let's break down what each of these literally looks like in the real world.
First up, fever. But we aren't just talking about feeling a little flushed after a walk. You're looking for a fever that hits exactly 38 degrees Celsius or 104.4 degrees Fahrenheit. And the really crucial detail here is the timeline. You need to report this if it lasts for at least 2 weeks without any obvious sign of a regular infection, like a random cold or the flu. That specific number over that specific amount of time is a major flag.
The second B symptom is night sweats. And this brilliantly illustrates the difference between a normal change and a medical symptom. Feeling a bit warm overnight because, the room is stuffy or you have a heavy blanket, completely normal. What your doctors actually need to know about are drenching night sweats. I mean, you are sweating enough to literally soak the bed, or you have to completely change your clothes in the middle of the night. And again, timeline matters. If this keeps happening for more than a month, that's a true B symptom.
Next is unintentional weight loss. The magic number to keep in your head here is 10%. If you are losing more than 10% of your total body weight over a 6-month period and you're not actively trying to lose weight, no new diet or intense workout plan, that is a hugely important sign. Your body is burning energy differently and your doctor absolutely needs to know about it.
Finally, let's talk about fatigue. Honestly, it is so easy to brush this one off as just everyday tiredness or, oh, I just had a rough week at work. We've all been there, but a true B symptom, that's a significant, profound fatigue. It's a real, heavy exhaustion that makes your normal daily activities, the stuff you usually do without thinking, genuinely difficult to complete. If you hit a wall and simply cannot push through your normal day, you need to write it down.
So the crucial point is this: it is always better to mention it than to guess. If something changes in your body and it feels substantial to you, jot it down. Tell your team. Please do not sit at home trying to play detective. Bring those clues straight to the experts. Speaking up, it's always the right move, for sure.
Section 3, The Power of Questions and Demanding Clear Understanding.
Okay, we've talked about how to report your symptoms, but remember, communication goes both ways. Now we're shifting gears. We're moving from you giving information to you actively extracting it. Have you ever had a doctor say something vague like, well, just keep an eye out for complications, and then they just walk right out of the room? So frustrating, right? Here's an exact script to use. What would that actually look like in real life? Demand practical examples. That way, you know exactly what to look for when you get home.
And what about when they order a new test or suggest a new treatment? Don't just nod and passively accept it. Ask them, why does that option make sense? And what are the trade-offs? You have every right to probe the reasoning behind your care plan. Understanding the why and getting a realistic picture of the downsides puts you firmly in the driver's seat.
And please, whatever you do, never assume you should just magically understand the medical jargon they're using. That language can be incredibly confusing. If you hear a term you don't recognize, stop them right there and ask, can you explain that in plain language? Remember, clear understanding isn't some luxury reserved for medical professionals. It's your absolute right as a patient.
Let's move on and see how this builds into one powerful, overarching mindset. Just keep asking why until the answer makes total sense to you. Be relentless. Be polite, of course, but do not leave that office until all those puzzle pieces fit together perfectly in your mind. Why is arguably the single most useful tool you can ever bring into that exam room.
So let's wrap all of this up into your appointment toolkit. First, track any changes and bring those written notes with you. Second, know the specifics of those B symptoms, fever, night sweats, weight loss, and fatigue, and report them promptly. Third, write your questions down the literal moment they pop into your head at home. Fourth, keep asking why until it clicks. And finally, demand plain language. Oh, and by the way, taking notes during the appointment is just as vital. It helps you lock down exactly what decisions were made so you know your exact next steps.
We've covered a lot of ground today, and hopefully you're feeling much more equipped to handle that next medical visit not just as a patient, but as an equal partner in your care. So I want to leave you with this final thought. Look at your notes right now. Based on everything we just discussed, what is the very first question you are going to ask your doctor at your next appointment? Don't wait, write it down right now and step into that room with absolute confidence.
Thank you for watching. For additional information, go to innovahub.ca, and to join in the conversation, join the CLL Community Canada Facebook group.